Hi Paul, hope you're well. Just finished another living room workout in lockdown Mark 3. I was just wondering whether you had any tips or advice on exercises for shoulder. I get pain inside the joint on my right hand shoulder, and I was wondering if there was any tips or exercises for shoulder mobility and shoulder health. Okay, look forward to hearing from you. Thanks, see ya.
Thanks Keith for that message, and hopefully I can help you out with that shoulder. Welcome back everyone to FitDadsUK. So shoulders, obviously normally as a physio would be looking at the shoulder individually and be looking for any history there and see if there's anything obvious that's caused the problem with the shoulder. There's no obvious history there with Keith. He doesn't seem to have fallen on it or done any sort of serious damage to the shoulder. The first thing we need to know about the shoulder is actually what is inside there. So you've got the actual joint itself. So with the bone, obviously your arm bone here, this is called your humerus, and then the end of this arm bone, which is the rounded part of it, sits on what's called your glenoid fossa, which is basically like a little bit of a cavity. And then basically the shoulder moves around in that sort of cup, as it were. It's quite a shallow cup. The hip, for example, is much more deep in the joint, and the reason for that is we trade off stability in the hip, but we lose range of motion. So we need lots of range of motion around the shoulder. Obviously we've evolved through millions of years to need that sort of range of motion. To be able to reach up your back, all the way around the back of your head, for example, are things you can't really do as well with your hip, most of us anyway. So the problem with that is because we trade that off, we get a lot more issues with instability, and it's a bit more vulnerable to injury. So Keith's describing obviously discomfort in there, and he's described in the past a little bit of clicking. The main things that will cause a problem in your shoulder, and that's not to say it's always this, but the first point of call that we usually think about is the rotator cuff, and one particular part of the rotator cuff. So one muscle is called supraspinatus. So that basically lives on the top of your shoulder. So there's 4 muscles in your rotator cuff. 2 of them sort of stabilise the back of the shoulder, 1 comes round and stabilises the front, 1 stabilises the top. It's designed to keep that joint in the centre, because what happens when you go to move, the joint wants to come out because it's so shallow. You don't have that issue around the hip because it's more encapsulated. So these muscles act to keep that shoulder centralised. What happens sometimes is when we don't strengthen, we don't condition the rotator cuff enough, and we overemphasize the bigger muscles around the shoulder when we're doing exercises such as the deltoids, such as the pecs, when we're doing all these movements. Usually it happens with quicker motions that you do tend to get this excessive movement, and then you get a pinch, and then you can cause a problem. It can cause tears, inflammation, all sorts of different issues. But that's why it normally happens. So the best way to start with rehabbing these shoulders generally is to try and stabilise and do some strengthening and conditioning work for your rotator cuff. So that's the most important place to start. So I'm guessing that Keith probably doesn't do enough of these rotator cuff exercises. He's doing more heavier weights around the shoulders, whether that be shoulder presses, chest presses, all different types of exercises. So what we'll do is we'll go through some of those. Important note here is if you're getting any severe clicking or feeling like something's catching in there and it's quite painful when you're doing any of these movements, then don't do them. You need to have the shoulder looked at by a professional. You probably need to have an MRI scan on that. So I would say don't do that. You can obviously try and rest that shoulder, try some ibuprofen, anti-inflammatories, see if that settles, and then try them again. But if that persists, you need to get that looked at. So that's the first thing I would say. Obviously, if you've had any trauma and you've fallen or done any serious damage and there's reason to sort of think that there might be something else going on there, again, that's something where you want to get your shoulder looked at. But a good place to start is obviously a bit of rest, a bit of anti-inflammatories, and then we'll try these exercises. So we'll go through them now. You need to get hold of some elastic resistance band, TheraBand, whatever the brand name is, doesn't really matter. They tend to come in colours to categorise the tensions. You're normally yellow, red, green, blue, black. Some companies might do them differently. Red is typically given. Green's not too bad, you can use green as well. It doesn't matter too much between the red and the green. If you've got a longer length on the band, you're going to get less resistance. If you've got a short length on it and you're trying to pull it, you're going to get more resistance. So you can sort of play around a little bit. If you've not got red and you've only got green, just have a longer sort of length on it. So the first one we want to do is external rotation, which basically means turning the shoulder outwards. So this is internal rotation, this is external rotation, okay? This is flexion, abduction coming out to the side, adduction, AD is coming inwards. The basic place to start is with your elbow tucked into your side. People tend to say they're getting more pain when they're a little bit higher up. When the elbow comes up towards shoulder height and above, they're getting more pain. That's because the shoulder's closing up. So we're going to put more strain on the muscles the higher up we do the exercises. So always think of this gap between your elbow and your body. The closer you raise your elbow to your body, generally the easier the exercise is, and the more higher grade the exercise is, the higher up we go, okay? So we can start just horizontally, and basically we're keeping everything else steady. You're rotating through this bone, so we're not moving the elbow stays where it is and the shoulder stays where it is. And we don't want, as what Keith would call body English, and we don't want all this sort of swaying around and pulling. We want to be nice and steady, okay? Make sure you're up in a good position. We don't want to be slumping forward and doing these exercises like that. So we want a good posture, okay? And then these should not be difficult. And I think the main reason why a lot of people think, well, these aren't going to do anything is because they don't really feel difficult. What we're doing though is we're trying to just activate those rotator cuff muscles to wake up a little bit and start to work. Because if they start to work before we do bigger, stronger movements with our shoulders and they stabilise the shoulders better, then we're going to get less impingement, it's going to get less problems, the shoulder's going to be more stable through harder movements, okay? So I'm not getting hardly any movement through the side of the arm, yeah, it's not going backwards and forwards, it's staying pretty much where it is. So to make that more difficult, like I said, we move the elbow further away from the body. What happens there is this angle of the band has to change, because if I've got my elbow up here and I'm trying to externally rotate, I'm pulling the band this way, I'm not pulling the band this way anymore. So we need to alter it accordingly so we're at a right angle. So if we've got the elbow to here, we want the band at a right angle to your arm. If you're at this sort of height, again, we don't want that elbow to move from the area that it's in. We can increase the tension a little bit if we need to. If you think it's a bit easy, keep that elbow in the same area. Good posture. Keep the shoulder blades tucked as if you're trying to put your, I always say, imagine you try to put your shoulder blade down towards your back pocket. So you're tucking your shoulder blade down as you do it. Fix everything. Don't be too tense, but try and keep your posture good whilst being as relaxed as you possibly can. So keep a good posture, but try and relax. And the key with these is lots of repetitions. So we're talking like 3 or 4 sets of 20 here, just bang a few repetitions out. If we're starting to get tired and lose the posture a little bit, then obviously stop and rest. And then to increase that further, because if your elbow comes up here, the angle of the band is here, you can just stand on it. So put your right foot on it, okay, and then stabilise your shoulder. Again, good posture, tuck your shoulder blade back, basically coming up like this. Try and keep it in the same area. So what common mistakes people will do is the elbow drops, yeah, or you start swinging the body around like this, okay, so keep it nice and steady. That's going to challenge more because your shoulder's closing up more. So this is how we progress people to enable them to start to come up and do exercises with weight. That's how we progress it. So always think about this gap between your elbow and your body, okay? So we're starting here, we can gradually increase as we get better, as we get stronger. So that brings us on to internal rotation. So as we said before, same rules apply about the elbow being close to the body or away from the body. So with the band, I've got a fixed point because my door's over here. What you need to do is tie a knot in the end of your band, okay, and then you can swing it into the door and trap it into your door. And the good thing about that is you can adjust the height that you put the band at. So I've got mine trapped in the door at around elbow height. I'm going to show you with the left shoulder now just because of the location of my door, okay? So same rule applies, you can wrap that band around your hand, keep your elbow tucked in, good posture, nice and relaxed but good posture. And then we want tension on the band when your arm is fully externally rotated. We don't want slack still on the band when we're here because we're not getting much resistance. We need resistance from the full range. So your arm needs to be fully externally rotated, but We need to maintain that posture and then keep your elbow tucked in. Once it starts to pull your elbow away from your body, we're using different parts of the joint there. And then the same thing applies. These will feel quite easy. I tend to give these more if it's more of acute pain, but I do think they are important. They shouldn't be overlooked because it's an important part of doing chest press, for example. You've got a lot of internal rotation. We need stabilisation across the front of the shoulder. And because this is internal rotation and it passes across the front of the shoulder, we do need to work on the stabilisation because it gets overpowered by the pec muscles. So we need to make sure that this is actually kicking in a little bit. So this is what we call the subscapularis muscle. That's the name of the muscle. So we'll sort of try to activate that. These are relatively easy down here, and most people will feel that they're ready to sort of progress and come up a little bit higher. So I'll show you the progression of that one now. So I've trapped the band up toward the top corner of the door. I can move my elbow away from my body a little bit. So again, good posture, keeping my elbow and keeping from here to here in the same place. I'm just looking for rotation through here. So basically what I'm doing is I'm pulling downwards. These can be useful for people that play racket sports and do overhead shots. People play badminton, tennis, cricket, throwing cricket balls, bowling, stuff like that. So anything that needs internal rotation, we can work through the stages of this. We can start lower down, keep it nice and easy, and then ultimately to progress that further, you can come almost horizontal. Again, we're externally rotated. Again, we're mimicking like the throw motion, and then again pulling forwards. Try not to move too much. We can progress these further towards end stage rehab where we're doing full functional movements where there'd be throwing motions. But to start off with, this is what I want to just to activate the rotator cuff. So rotating inwards against that band. Start to get tired through here, then we have a bit of a rest so we don't lose our posture. Okay, that's internal rotation. So we've done external rotation, we've done internal rotation. Okay, now we're going to work on the muscles which sort of pull outwards a little bit on the shoulder. So this is more of a sort of compound movement where we're doing a few different movements all together just to try and get some activation of this rotator cuff as a group of muscles whilst we're doing a typical sort of quite common movement that you might do. And that movement is sort of reaching upwards. So what you want to do is get the band, you want to roll it around. So you've pretty much got your hands at shoulder width apart with a gentle pull. So we don't want it to be really tight, we just want to have to gently pull to get your hands to shoulder width. Okay, and what we're doing is, I always say to people, the way I describe it to people is make a banana your body. And what I mean by that is sort of arch your body backwards as you reach up, or imagine that you're reaching up to put something onto a high shelf. Okay, but you're trying to do that using your whole body, so lower back, all the spine goes, and look where you're reaching with your hands, with your head. So don't just do this with your head down, because if you look with your eyes and look with your head, that makes your neck go, it makes the upper part of your back go, and your spine follows suit and follows through with the movement. So we're just trying to re-educate a sequence of muscles activating in the correct order with this exercise. That's the reason for it. So some people feel a bit silly doing them and they feel like they're not getting much out of it. So I think it's important to understand a little bit of the reasoning behind it. So we're banana in the body, so we're basically following with your eyes and looking at your hands as we look up. Gentle pull out, hands to shoulder width as we go. Okay, so do that first, and then we're basically reaching up, arching through the back. Try and reach up as high as we can. I know you can't see my hands there on the shot, but just step forward, just one step with one foot, and just alternate left foot, right foot with your repetitions. Take a step, just one step forward. That helps you then to arch the back as we reach up, follow and look up. Okay, so you see, take a step forward, reach, look up, make sure everything's following suit. Okay, keep that tension. Don't forget to keep that tension all the way up, and keep the hands at shoulder width. We're not going out like this, yeah, we're not losing that tension as we get to the top. Control that tension, okay, all the way up. And for the fourth exercise, exactly the same motion, but the opposite. Instead of pulling outwards, We're squeezing inwards gently. So Swiss ball works. This is perfect. It's one of the kids' balls which I found. It's perfect because again my hands are pretty much shoulder width apart. You could go a little bit wider with this. A Swiss ball is fine. If you've not got anything like that, just get like a bottle of water or a bottle of cordial, something that's reasonably light that you can just sort of press inwards, anything like that. Kitchen roll, doesn't matter, it doesn't have to be heavy, it's just the fact that you can actually just gently squeeze it inwards and lift it up and down. So, exactly the same, squeezing inwards, take a step forward, gently squeezing in as we come down. Okay, so gently squeezing in, reach, and then come down. Simple as that. Okay, this one will directly load the muscle that tends to be the culprit, which is the supraspinatus, which pulls up. Okay, so one of the ways that we test this is we internally rotate, so we're turning the thumb inwards and downwards, internally rotating the arm, and then we add pressure to the top and we ask the patient to push up. And we can do that in various different positions to try and recreate discomfort in that shoulder and see if we can sort of identify that as being a problem muscle. So what we can do to actually strengthen that in that position, if we're at the stage where it's not too painful but we still feel a little bit of discomfort, then what you want to do is if you're doing your right shoulder, stand on the band with your left foot. So we've got a bit of tension in it from the bottom. So you may not be able to see all the way down to the bottom here, but we want tension from the bottom. We don't want to be getting up to here and then just getting rid of that slack and starting to get tension on that band. We want to make sure that the tension is already there at the bottom through the full motion, okay? And then with the thumb down, keeping the thumb down, we want to come out and lift the arm up to the side. Again, we don't want to be moving the body, we want to keep good posture and we want to keep steady. If we're getting pain with this, then we don't go into pain. It's a subjective thing, pain. Mild discomfort, 2, 3, 4 out of 10. If it stays at that or it gets a little bit easier as you do your reps, fine. If it stays at that and doesn't really get any better, you just need to monitor it. If it's getting worse, obviously don't do them. Or just don't go up as high, reduce your tension a little bit. Even if we're just getting a little bit of contraction on quite a sore muscle at first, that's good, yeah? And then if we can get higher with these, any clicking or anything, don't go through clicking, okay? The angle that we're going at, we're not going straight in front of the body, we're not going straight out to the side of the body, we're going up in what's called scaption. What scaption is your scapula sits at a little bit of an angle on your back. It's the natural motion that if you said to someone, lift your arms up and down, that's the way they would do it. They wouldn't do it straight out to the side of the body generally, and they wouldn't do it straight in front of the body. Naturally, where the arms sit most comfortably is in scaption, okay? So that's what we do it in that angle. So you can see how I'm standing a little bit diagonally. It's kind of at that angle. It's a comfortable, normal angle to lift your arm up at, okay? So thumb down, repetitions like that. That will directly load that muscle. Another area to consider is your upper back, thoracic spine. Anything that's got a rib attached to it, here to here, is classed as your thoracic spine up here. Obviously a lot of us sort of tend to lean forward, desk jobs, just general posture anyway, so that will have a bearing on your shoulder position and make you more prone to getting shoulder problems. So if we can work on just trying to get your thoracic spine or your upper back into better posture, then that can help you as well. So a good one, which is in one of our workouts already, is trying to do upper back extensions. Feel like your shoulder blades leading that movement. We're pinching something between the shoulder blades. You're not rocking your body backwards, it's not all elbows. Because if it's all elbows, you're just using your triceps really and a little bit of your lats. So you want to be using the stuff in between your rhomboids, your lower traps and mid traps. Yeah, so again, shoulder blades down towards your back pockets. If your back starts to arch backwards as we do that, that's fine, as long as the shoulder blades are the ones leading that motion, okay? So you can start with light resistance, but the idea is obviously we're just trying to get that extension through there, get that shoulder back into a better position so it's not hanging forward, it's more open, which then creates more space for freedom of motion. So really good exercise to do there to help your posture. And finally, let's finish off with a few stretches. So if you, for example, you've done some thoracic extensions, you can get some tension in your back. It's good to create toning in those muscles and help your posture, but if you do them without stretching, I feel that you can start to develop a little bit of tension there because you overwork the muscles maybe and they're not used to it. So good stretches, obviously rounding that upper back off. I know it sounds like counterproductive against posture, but if we're doing it as a stretch, then it obviously just gives all those muscles a good stretch there. We can do that with the arms at different heights. We can do it a little bit lower down, we can do it higher up. We can also just do that a bit more individually for one side. We can sort of pull that shoulder blades round and round. So tend to hold these for about 20 seconds or so, just try and hold them. You can do them as shorter stretches and sort of mobilisation repetitions. It's all down to personal preference and how you feel it loosens you up. If you feel like it loosens you up more, just doing a few gentle repetitions with it, do that. If you think it's better holding it, experiment. You just see what works for you. That's a really good stretch just to sort of loosen off those muscles that we've tightened up here from doing these retractions with a band. So give those a go as well. Another place we want to stretch off is across the front of the shoulders as well. So a good place to do this if you've got a doorway. You can rest one forearm on the door frame and the other one depending on how wide your door is, and then just basically gently leaning into the door. That's going to then open up the front of the chest, stretch the chest. Another place to do that would be lying on your back on a weights bench with no weights. Basically just open your arms up into a sort of natural position, don't need to be too high, natural position, just allow them just to hang, just to stretch off the front of the shoulders and give them a nice release. After you've done your weights particularly helpful. So that's a really good stretch just to open up the front of your chest as well. So there you have it, guys. Hopefully it's concise enough and it's not too long-winded. Obviously I wanted to give you the information that I feel that you need and hopefully get some value out of that, and it can help you if you are suffering with shoulder pain as well. I hope it helps you out, Keith, and helps you with your shoulder. It's a really good place to start there. Some pretty obviously basic exercises. Again, everyone's individual. I pointed out at the beginning of the video, if you're getting anything like a lot of pain, you're getting clicking, you have had some trauma, then it is best to get it looked at. So please take it with a pinch of salt. Obviously what I'm saying depends on what's happened to your shoulder. There are other things that can go wrong. For example, I'll put a list there of different things that could possibly happen that might be worth checking out. You can have labral issues, which is basically the capsule around the joint, which is a passive tissue, meaning you don't really have control over it like your muscles. You can control your muscles. So there are passive things like ligaments and capsules that can be causing you with problems as well. They can heal. Some of them struggle to heal because they have less blood flow. If you're getting persistent issues, then that's obviously why when you want to be referred on, you want to see a consultant, you want to have a scan, you want to see a specialist. So obviously take that with a pinch of salt. Good place to start though, as long as you're following the rules, where if you're not causing you too much pain, then obviously don't do it. A really good place to start. So I hope it helps. Take care, guys, and see you in the next video. And remember, who's a daddy?